You might be surprised to hear that over 82% of knee replacements worldwide are in place for over 30 years. So they last very long and they're nearly comparable to hip replacement longevity at this stage. Well, there are a number of factors that can affect the lifespan of a knee replacement, and obviously age is one of those factors. The younger you have it done, the more likely you are to use it more, to be more active in terms of the activities you do, to put more impact through the knee, and your expectations from that knee are far higher. You want more from that knee than someone maybe who just wants to remain somewhat mobile, who's elderly. So there are a number of factors that can impact. Aside from age, your weight is a very important factor. Maintaining a healthy weight and a healthy diet is very important, and maintaining a minimal level of activity after the surgery, because when a knee replacement is performed, the outcome relies on the muscle support that you have around the knee and your level of activity to ensure that you have a good outcome. You're far better having a knee replacement performed when you're younger if it's indicated and advised to you by your orthopaedic surgeon. Why put off a good lifestyle, a healthy, recreational, professional lifestyle, time enjoying activities with your children until you're in your 70s and 80s, when you can achieve this with advanced arthritis in your 50s or 60s? If you're living with pain due to knee arthritis, you're going to naturally stop using your knee as much as you used to because it's causing you pain. In turn, that's going to cause stiffness in your knee, and following that, you develop significant reduction in your muscle strength. So why compromise yourself? You shouldn't be hesitant to consider knee replacement surgery if it's been advised to you by an orthopedic surgeon, if you've exhausted all other non-surgical options, and you're living in pain, which is having an impact on your quality of life, either professionally or recreationally or socially or emotionally. Why put off the chance to get rid of your pain completely? If you're experiencing bad knee pain, talk to your GP, talk to your physiotherapist, arrange an assessment, which will probably include an X-ray, and following that, a decision will be made on whether you need to see an orthopedic surgeon or an expert.